should all have strong common goals. Otherwise, it is very difficult to commit. If we commit with things that are too specific, or we should commit with real things. I have been saying, for example, that when people ask me what I'd like to see, I say I like to see different numbers in the T1D index. It is very uncomfortable to me to see that in Brazil, for example, that we have universal health coverage, that we have analogs available, that we have strips, that we also have people in insulin pumps, sensors, etc. According to T1D index, there is a reduction of life expectancy in people with type 1 diabetes on average of 25 years. Wow. In comparison to the rest of the population. How is it possible?
Welcome to Global Diabetes Insights, your go-to podcast for navigating the world of diabetes. I am Tino, a certified diabetes educator and a global advocate for non-communicable diseases.
And I'm Kona, a global advocate and a medical doctor. Together, we're your hosts, dedicated to raising awareness, fostering open discussions, and creating a safe space for everyone affected by diabetes.
Join us as we dive into empowering conversations with individuals living with diabetes, caregivers, healthcare professionals, and researchers. Our goal is to not only guide you through effective diabetes management, but also to inspire advocacy for proper healthcare access.
So get ready for a journey of insights, ideas, and diverse perspectives. Let's amplify our collective voice and create positive change. Get involved, get engaged, and join us in creating the change we need. So welcome everybody to Global Diabetes Insights.
Greetings, so I'm here with Mark. Welcome to the Global Diabetes Insights. So we're just going to ask a few questions. Mark is a well-renowned person in the diabetes advocacy space. You probably know him already, or in the non-communicable disease, not just diabetes. So maybe I'll allow him to introduce himself briefly to the audience. Mark, if you may, kindly.
Thank you very much, Tina, for the opportunity. It's a great pleasure to be here, and congratulations for this wonderful podcast that is informing and updating the entire global diabetes community. So I'm Mark Baron. I'm founder and general manager of the Intersectoral Forum of NCCs/NCDs in Brazil, and well, happy to be here.
We cannot thank you enough for being here. The podcast has been there since 2020. And of course, I was even looking for an opportunity to say I would need to have a sit down with Mark, maybe on a face-to-face, not just the small videos like you see on a Zoom link. I try not to do that, but it's an honor for me yet to have him, because we know that like in the diabetes space or in the advocacy space, there are very few gentlemen there. Mark is someone that we look up to, and because he's been in the advocacy space for too long. So maybe the first question that I have for him is, knowing that Mark is a relentless advocate for diabetes and non-communicable diseases, we know that people really have doubts. They don't really know what advocacy is. We know that action or advocacy without action is just noise. People think maybe protesting is probably the best advocacy work. So maybe to Mark, what's the single biggest policy failure in the global NCD management today, and how do we fix it? What can we do to fix it?
Wow, I thought that you were gonna ask an easier question, but okay, let me try to help. Obviously, I think there are many challenges nowadays in terms of policies for NCDs. That's why there is a feeling that we are not yet doing a good job in NCDs. So we see, for example, there was the obesity atlas that was just launched 2 days ago, showing that obesity is growing everywhere and it's impacting health everywhere, and it's one of the leading causes of several other non-communicable conditions, very serious thing, and so why we can't stop obesity and several other things. So we have been discussing type 1 diabetes, for example, so why there are still so many people without access to basic things like insulin and strips, which is, as we know, a death sentence to many people who receive the diagnosis, and if they don't have access to those basic things. I believe that there is still a lack of commitment, a global commitment, to really develop policies and for a global assistance in NCDs. So we saw this in several communicable conditions that multilateral agencies, countries got together in order to truly solve the problem, to bring solutions to the global population. But for NCDs, I think this is still lacking, and it's very serious because it's already the group of conditions that are hitting most of the people in the world. We don't see a path for improvement in near time.
Wonderful. Thank you so much, Mark, for that. And I know, since as a person who is directly involved in some of these big discussions, decision making, and other people are on the receiving end, they might not really see the impact of what is really happening. Are there any changes? But we know there are talks behind the scenes, people are discussing, because type 1 diabetes is just complex. And I know there are lots of things happening behind the scenes. With everything you know, especially talking about the healthcare system in low to middle income countries. I know Brazil is one of those countries, but what Kenya really is missing from comparing with what we have in the higher income countries and in the low income countries? We have the best healthcare systems in the higher income countries, and we have the most poorest in the low to middle income countries. What could be the reason?
Obviously, there are many reasons and there are many things, many differences. Our concern is that we see those differences growing instead of being reduced. So the high-income countries with more access to even better technology, better insulins, better everything, and the low-income countries still trying to develop the very basics. So while in high-income countries it is getting better and better, in the low-income countries, it's still trying the basics. I think at least what is in the essential medicine, essential technologies of WHO should be everywhere. I think this should be guaranteed by all the countries together. I think this should be a work of high-income countries working with low-income countries, with the multilaterals, with all the society to guarantee that what is essential is available to everyone. And something also that concerns me, that I'd like to share is when we talk about affordability in any place. So what is affordable? If we talk about affordability as, it should have a price that is accessible, that people can afford. So we are probably talking about the average, which means that there will always be a group that won't be able to afford those essential medicines, those essential technologies. So in my mind, what is essential should be available for free to everyone in all the countries. And I think this is key if we truly want to change the scenario we see today.
Wonderful. Well, thank you so much. I think there was one conversation that we had, like when you talk about the disparities that are in the systems, you might find that even in one country, there are other parts of the country that are probably receiving maybe better care than the others. Briefly about Brazil, what is the situation like? I know maybe people that are from the capital, they have different type of care that they receive that probably everyone else wishes to have. In the same country, there are so many differences. Probably people in the capital, they receive the best care, free medication. What can you tell us about that?
That's a very good question. And you're totally right. In Brazil, we have progressed a lot in terms of what is available. So the services also that are there for people living with diabetes. But there are still big differences in terms of who's living in a big center and who's living in rural areas. For example, analog insulins, they were incorporated, so anyone with type 1 or type 2 diabetes that need analog insulins would receive them for free from the government, though still they are received only through the high-cost medicines pharmacies. And high-cost medicines pharmacies are not everywhere in the country, so they are in the big centers. So the ones who are in the rural area and who have no means to buy those medicines, they are far from those pharmacies, for example. So then there comes another advocacy movement in Brazil. There is to bring those analog insulins to the primary health care, because primary health care is everywhere in the country and human insulins are available through primary health care. Why aren't analogs? This is one example, but obviously there are other examples such as the access to endocrinologists. So if you are in a capital, in a big center, it's easier to have access to an endocrinologist. If you are in a rural area, it's much harder to access an endocrinologist. But fortunately, Brazil now is investing a lot in telehealth and in digital health, which we believe will be a way of improving this situation to have, so even if there isn't an endocrinologist in so a faraway rural area, the primary healthcare doctor can talk to the endocrinologist, can receive the guidance from the endocrinologist on what to do, how to manage those individuals with diabetes in the rural area.
Incredible. Thank you so much. And I remember like when I had this one conversation with somebody from Novo Nordisk, she even mentioned we know of the medications that we are manufacturing. We know of the insulin that we are manufacturing. Over 15 million vials are manufactured. By the 95% of the people that use this human insulin are from low to middle income countries. And to me, that was no surprise because I knew people choose to use human insulin because it's probably affordable, it's cheaper. But now we know some other advocates, T1 International, for example, they advocate or trying to encourage people to make rapid-acting insulin would be added on the essential medicines. Probably that would be a game changer. If it's something that is done by WHO, our countries will respond to it. We need to align ourselves to what the global world is doing. The diabetes communities internationally, people are talking about CGMs, time in target range, but people in the low to middle income countries, they're still to talk about HbA1c. They feel like if my HbA1c is perfect, then that means good quality life for me. But that's just one angle. That's not everything. We want to know if you can be on a target range. For more than 70%, that's okay. As a person who has been discussing at these UN level, United Nations, General Assembly, UNGA, you've been there. What's the most uncomfortable truth about the global health partnerships that no one wants to admit?
Most uncomfortable truth. What I feel is that we should all have strong common goals. Otherwise, it is very difficult to commit. If we commit with things that are too specific, or we should commit with real things. I have been saying, for example, that when people ask me what I'd like to see, I say I like to see different numbers in the T1D index. It is very uncomfortable to me to see that in Brazil, for example, that we have universal health coverage, that we have analogs available, that we have strips, that we also have people in insulin pumps, sensors, etc. According to T1D index, there is a reduction of life expectancy in people with type 1 diabetes on average of 25 years.
Wow.
In comparison to the rest of the population. How is it possible? So I think we need to commit to big changes, not just small commitments, not only to localized, specific things.
Well, I think that's a great statement, great sentiment that you shared. We know the problems that exist, and we know, but people are afraid to just commit to make those big commitments, like you said. Yes, it's an uncomfortable truth. People know really what is missing. They know how best to do change. We know even for someone with just a diagnosis of type 1 diabetes, even if you have the best care, the years that person would live are reduced because diabetes is very complex. It needs multifactorial risk reduction strategies. You need to be seeing a psychologist to have the best care, like say CGMs if you have access to it. Other people might choose if they want to use it or not. We've been seeing so many people meeting, discussing at the WHO, World Health Assembly, but then we don't see the movement, we don't see the impact.
Yeah.
So many discussions are being heard, but what are they talking about?
Yeah, something that you said before, so the access to analogs, to strips, to technology, and obviously the concern about HbA1c, etc. So something else that we all know, we all have been talking about this for decades, let's say, is that treating complications is much more expensive than
to treat the diabetes.
To treat diabetes, so diabetes care. In general, in Brazil, there are 2 studies showing for type 1 and type 2 diabetes showing that the costs increase from 25 to 30 times the cost of treating the diabetes when you need to treat also the complications. So what are we doing to really change the situation? So for example, in countries where there is an insulin, so where insulin depends 100% on donations, and a new child that is diagnosed would have difficulties to start in the donations program, so from one day to the next. In other countries that we hear that people receive 1 strip a day, so how can you truly manage with 1 strip a day? We have been talking about carb counting. How can you do carb counting
if you don't have food?
Yeah, if you don't have food, if your insulin is unpredictable, if you don't have strips, I think there are challenges that we need to commit with, otherwise
That's
we
ones.
won't
Wow. Thank you so much.
progress.
Thank you so much, Mike, for that. That is just really what we need. We know what we need. And it's always great, like also to hear from people living with diabetes who are also engaged. Yes, we talk about meaningful engagement. Thank you so much for using your voice, not just for the voiceless, but for all of us, even with our voices, who might not even get the chance to sit on those tables. So thank you for everything that you're doing. The next question that I have is, as a person who is representing people living with diabetes on these bigger tables, you have been living with diabetes since childhood, being involved in the policy changes that really impact the millions of people. Have you ever felt disconnected from the realities of people living with diabetes that you're advocating for? And how do you keep yourself accountable as a person living with diabetes, knowing that you're not just advocating for yourself, but you're also advocating for other people living with diabetes? Because they might say, we just want one person. The Minister of Health might say, we just want one. And then, so I remember one day you said, I want to talk from the community perspective, but also I want to wear a hat as a person who is leading.
Yeah, I think it's important to know the reality of your community, of your country, and of neighbor countries, the region and global situation, in order to speak. Otherwise you may make a mistake, you may be claiming for things that may not be there yet. It's very important. It's hard.
Definitely.
Because usually it's easier, and not because you are not a good person, but
Right.
because it is truly hard to see what is too far from you, from your reality.
Definitely.
It's important that if you are talking on behalf of a group, that you go to the group, you listen to the group, be able to truly bring their voices. Otherwise, you may be making a mistake.
Definitely. Yeah, misrepresentation will be good. You, Mark, you might have access to a pump, a CGM, but probably it's just 1% of people living with diabetes in Brazil who have access to the things you have access to. So if you want to really represent them, you really need to engage with them. So I'm glad you do that, because you also have a diabetes organization or NCDs that really speaks about these things, representing people that are really impacted by the condition. So thank you so much for all that you do. As we move forward, they say Brazil has made significant strides in diabetes care. Yes, we know that, but systematic gaps still remain. If you had the power to implement one radical, game-changing reform overnight, what would it be and why?
I think it would be key to have registry of people living with diabetes.
Wonderful.
Connected through other digital strategies. So to be able to monitor where they are, who they are, how they are doing, if they are receiving their vaccines, for example, connected to that, diabetes education. So it is one big thing that misses in many of the countries. So a well-structured plan of diabetes education, because sometimes people are receiving everything to do well,
Right.
but they don't know how to. Their information, they are limited in order to do more with what they receive in terms of anything, technology, insulin, medication, etc. So yeah.
Data is the top of the moment. Without data, it will be difficult even to measure up. Even if there are people who might want to come and support in your country, there are other global investors out there. They might want to come and do something, but if they don't know what is available, if there's no policy, they don't know how many people have diabetes and who has access to what, it will be difficult even to just try to change anything. So yes, diabetes registry would be a great thing. So thank you so much for working that out. Usually people say, if people can have access to free medication, I say in Zimbabwe even if insulin is going for $5, there's still someone who cannot afford it. Mm-hmm. Some people say it's affordable, but affordability differs on whom you're talking to, and also if they have enough disposable income. Do they have anyone in the family who goes to work? How many people are in that family? So things are different. So yes, the diabetes registry would really be impactful, like in a million, like to the entire community of people living with diabetes in Brazil. If the government sees that we have, maybe say your population, how many are you in Brazil, roughly?
220 million.
220 million. Let's say 20 million people are living with diabetes. That would mean the government's approach on how they want to do things would be different in a way, because now they know. Because that's a lot of people, right? But though, of course, it might be less than 10%, but that's still a good one, because we'd need to know how many people are impacted. If we can also do what Brazil is doing, because I know you're not satisfied, you still want to continue doing great. Last question to you, Mark, would be, your work, it bridges healthcare politics and activism. In your experience, who has more power to drive change? Governments, industry leaders, patient communities, and are you using that power effectively? You as an activist, you as a person living with diabetes, you as a global leader in the diabetes spectrum. Who has the power?
Yeah, I think you know what would be my answer, but before answering that, something that I'd like to talk about, that we mentioned about insulin analogs, etc., that it's available in Brazil. And I'd like to emphasize that analogs are not available in Brazil because Brazil became a rich country, but because Brazil had a policy stating that the analogs would be procured by the government only when they reached the same cost of human insulin, and we succeeded on that. So that is possible, and I want to share that to encourage other countries also to negotiate with industry, and maybe if they're not as large as Brazil, to procure large volumes and be able to negotiate to do full procurement in the regions. I think that's key in order to give access to the population to whatever is needed. But going back to your question about what drives the changes, if it's government or
Industry,
private sector
community.
or advocates, it's the partnership in between the different sectors. I think that's key because each one of the sectors, the stakeholders, they bring their own knowledge, capacity, their skills in order to contribute and to truly bring something to move the needle. It's key. I think if we ignore any of them, it's too risky because it's like our government trying to do the best, but they haven't asked people living with diabetes if that's what they really need. So maybe they will do something that won't solve the problem. And the same if just don't talk to private sector because thinking that private sector is dangerous, etc., etc. So maybe the private sector would also bring some contributions, so proposals, some ideas, some ways they develop to deal with certain challenges that we may be facing. So they may also bring important contributions to the table.
Wonderful. Thank you so much, Mark. And I don't know if you have any last words to the community, partners, everyone, people living with diabetes, industry, and even healthcare professionals who are also listening to this podcast. What are your last words to them?
Thank you very much, Tino, for this invitation. What I'd like to say to conclude here, to encourage so people living with diabetes to advocate, be informed, to be updated, but also to get connected with people like Tino, to learn on how to advocate for you and for your community, because what we see in certain places is that a lack of advocates is a serious problem because it usually takes longer to progress in places where the advocates living with the condition are not there.
Wonderful. Thank you so much, Mark. With all being said, we rest our case here, and we cannot thank Mark enough for everything, the insights, because as a seasoned advocate who has been in the game for too long, I think it's always great to listen to people with lived experience who know something, who are also involved in these discussions. And yes, you need to check it out even on this website. I will share those details on the description. You can just check it out to learn more what Mark is doing, what he's up to. It would be just great to connect with people like this because you can also know of the opportunities that exist in your region that you might not have knowledge about. So it's always great. So thank you so much, Mark, for everything. We hope that this podcast will continue to inspire you, to motivate you, and to educate you as it should. Thank you so much. Wonderful, Mark. Thank you.